Hello again, welcome back to Mediplaceboo. So far we have covered the bones of the shoulder region and the bones of the arm, and now we will be starting with the bones of the forearm, and first we will discuss about the radius. So now starting off with the radius is the typical long bone which is present on the lateral side of the forearm. So here we can take a look at the anterior aspect of the arm, in which we have the lower end of the humerus. Here we have the radius, which is present laterally, and here we have the ulna, which is present medially. So how do we remember that radius is present on the lateral side? It is easy, since we measure our pulse on the lateral side of the forearm with the help of the radial artery that is present on the side of your thumb. So on the lower end of the humerus, we have the presence of the radial artery, by means of which you can check your pulse. Since the radius is a typical long bone, we have the presence of these three regions, that is the upper end, the shaft and the lower end. So in the upper end, we would encounter the head, which is disc shaped. Next we have the constricted neck. Lastly we have the tuberosity. Since it is present on the radius, it is known as the radial tuberosity. In the region of shaft, we will cover about the three borders and three surfaces. That is, we have the anterior border, the posterior border, the medial or the intraosseous border. In the surfaces, we have the anterior, posterior and the lateral. And on the lower end, we will cover about the five surfaces. That is, the anterior surface, the posterior surface, medial, lateral and the inferior surface. Starting from the region of bones of the arm itself, on the lower end of the humerus, the radius attaches to the capitulum, which is present on the lateral side of the humerus. Superior to the capitulum lies a fossa, which is also known as the radial fossa. Radius, radial, you can correlate both these terms. Now, the head of the radius articulates with the capitulum superiorly, and medially it attaches to the radial notch, which is present on the bone of the ulna, here highlighted in red color. The superior portion of the head of the radius is articulating with the capitulum, whereas the medial portion is articulating with the radial head. The radial head is covered with the help of the annular ligament, which helps in the pronation and the supination movement, to which we will take a look in some time. So, moving downwards, we have the presence of a constricted neck, which is enclosed by the lower portion of the annular ligament. Also, on the medial aspect of the radial neck, there is attachment of the quadrate ligament. Moving downwards, we have a presence of tuberosity, which is smooth anteriorly and is rough posteriorly. On the anterior side, we have presence of a synovial bursa, and on the posterior side, we have the insertion of the tendon of biceps brachii. Also, there is presence of an oblique cord which connects the ulna and the radius, which is also present on the medial aspect of the upper end, inferior to the radial tuberosity. Here, the radial head and the radial neck are free from the capsular attachment, so they are free to move on the proximal part of the radius. So, on the proximal radioulnar joint, there is presence of two movements, namely pronation and supination. Here, we can take a look that when the radius is moving towards the medial side, the movement can be termed as pronation, whereas if the radius stays in its original position, it is known as supination. Similarly, on the basis of humero-ulnar and humero-radial joint, we have the movement of flexion and extension. Here we have the presence of the lower end of the humerus. Here I have shown the two positions of the radius while making the movement of the flexion and the extension. So here we have extended position of radius. When it moves towards the humerus, it is known as flexion. And we can say that when it moves away from the humerus, it can be termed as extension. Now, the movement pronation and supination occurs around the proximal radioulnar joint, which is formed by articulation of the head of radius onto the radial notch of the ulnar bone. So now we will talk about the shaft of the humerus on the anterior aspect. On the anterior aspect of the radius, we can take a look at two borders, that is the anterior border and the interosseous border, or also known as the medial border. The anterior border is present obliquely in its upper part, as we can see here highlighted in white color, while moving downwards it becomes vertical and ends near the ridge medial to the styloid process, where, as we have discussed, we can measure the pulsation of the radial artery. Next, we will take a look at the medial border. The medial border is also known as the interosseous border, since it has the attachment to the interosseous membrane in the lower 3/4 of the border. So in the purple color, I have made the interosseous membrane, which is present on the lower 3/4 part of the interosseous border. One more point regarding the anterior border is that it starts from the anterior margin of the radial tuberosity. Now, before moving to the posterior border and the posterior surface, I want to tell you about the anterior surface and the lateral surface. So in case of the anterior surface, it is present between the anterior border and the medial border. So here highlighted in red color, we have the anterior surface, and between the posterior border and the anterior border lies the lateral surface. Note here that the radial styloid process should be always present on the lateral side of the forearm. There are three key features which you must remember for the side determination of the radius, which are the upper end, the lower end, and the interosseous border. The upper end of the radius must always have the head of the radius, so it should be always present superiorly. Next, on the lower end, we have two key features, that is the presence of styloid process, which should always be lateral, and the second point is that the anterior surface of the lower end is quite smooth, whereas the posterior surface of the lower end has presence of grooves for the passage of tendons of extensor compartment muscles. The interosseous membrane along with the bones of the forearm divide the muscles of the forearm in the anterior compartment and the posterior compartment, that is the flexor compartment and the extensor compartment. Also, since the head of the radius is in close proximity to the capitulum, if there is any injury to the elbow joint, there are high chances that the head of the radius would be damaged, since it is present near the elbow joint and not the wrist joint. So now moving further, we will take a look at the posterior aspect of the radius. On the posterior aspect of the radius, in the upper end, we have the radial head, the radial neck, and the radial tuberosity. Note, since it is the posterior surface of the radial tuberosity, it will have a rough appearance, and the reason for it is because the tendon of biceps brachii inserts onto the posterior surface of the radial tuberosity. Next, we will take a look at the shaft of the posterior aspect of the radius. On the shaft of the posterior aspect of the radius, we have the posterior border. Similar to the anterior border, the posterior border also in the upper end has an oblique path, so we can term it as the posterior oblique line. It courses vertically downwards, so it can be termed as the posterior border. The other features on the shaft of the humerus are same as we have discussed earlier, that is the lateral surface, which is present between the anterior and the posterior border. Here we have the presence of the posterior surface, which lies between the posterior border and the interosseous border or the medial border. Here we have the interosseous border, and here we have the posterior border, in between which lies the posterior surface. Now, on the posterior aspect, we also have the pronator tuberosity, which is present approximately at the center of the lateral surface and is an insertion point for the pronator teres muscle. Now, moving towards the lower end of the radius, as we have discussed earlier, we have 5 surfaces, out of which the 2 surfaces has been discussed in the anterior aspect, that is the anterior surface, which has a thick prominent ridge, and the lateral surface, which has the presence of styloid process. And now we will discuss about the medial, the posterior, and inferior surface. So on the medial surface of the radius, we have the presence of the ulnar notch. Similar to the radial notch of the ulna, we have the ulnar notch of the radius, that is here the distal radioulnar joint will form and the ulnar bone will articulate in the ulnar notch. Next, what we have is the posterior surface. Here we are discussing about the lower end. On the posterior surface, we have the presence of grooves, which will allow the passage of tendon of muscles of extensor compartment. Here I want you to compare between the posterior surface and the inferior surface. Here is a diagrammatic representation of the inferior surface of the lower end. So starting with the extensor muscle tendon groove, we have the passage of the tendon of the extensor digitorum. Next we have the groove for the extensor pollicis longus, which can be seen here. Laterally there is the presence of the dorsal tubercle, which was earlier known as the Lister's tubercle. Next we have the groove for the extensor carpi radialis tendon, so in which we have both the extensor carpi radialis brevis tendon and the extensor carpi radialis longus tendon. And regarding the two leftovers, that is the extensor pollicis brevis tendon and the abductor pollicis longus tendon, will also make its way from the lateral aspect of the radius. Now since we are present on the inferior aspect, I want to tell that the radius attaches to the two carpal bones, that are the scaphoid and the lunate. Now let us discuss about the muscular attachments of the radius. So starting off from the upper end of the radius, on both the anterior and the posterior aspect, we have the insertion of the supinator muscle. Note that the blue colors and the red color is for the origin of the muscles, and here too we have the supinator muscle. As we have discussed earlier, the tendon of biceps brachii will insert on the posterior aspect of the radial tuberosity. From the anterior oblique line, there will be the origination of the flexor digitorum superficialis muscle, which is considered as the intermediate group of the flexor muscles. From the medial aspect of the shaft of the radius, we would have a long origination of the flexor pollicis longus, which will help in the flexion movement of the thumb, since the term pollicis refers to thumb. On the lateral aspect of the shaft of the radius, we have a small insertion for the pronator teres muscle, which would be originating from the medial epicondyle of the humerus. Next, in the posterior aspect of the shaft of the humerus, we have the origination of the radial head of abductor pollicis longus, and inferior to it lies the origination of the extensor pollicis brevis. The abductor pollicis longus will help in the abduction movement, and the extensor pollicis brevis will help in the extension movement of the thumb. Now, on the lateral surface of the shaft of the radius, we have the insertion of the pronator teres muscle, which we have also mentioned in the anterior aspect. Moving downwards, on the anterior aspect, we have the insertion of two muscles, that are the pronator quadratus, which takes its origin from the lower end of the ulna, and the insertion of the brachioradialis, which originate from the lateral supracondylar ridge of the humerus. That's all for this video. Thank you for watching the video till the end. If you like the video, please like, share and subscribe, and please check out the previous videos of the playlist of bones of upper limb. Thank you.